Hello, and welcome to this week's State of the State Show, our weekly conversation about Maine news and opinion. I'm your host, Christopher St. John, and today we're going to be discussing the state of Maine's effort to extend health coverage to healthcare workers. Unfortunately, many people who do work in the healthcare field do not themselves have healthcare benefits. And here to discuss that challenge and some potential solutions with us are Roy Gedat, who is the National Advocacy Director of the Direct Care Alliance, which is a national organization looking at this group of challenges for direct care workers. But I hasten to add that Roy, we're glad, is based in Norway, Maine, though he works for this national organization. Thanks for being here. So, Roy, tell us, who are what we call direct care workers in Maine, and what are their challenges in accessing healthcare benefits?
Sure. Direct care workers are the people that provide the hands-on care to our parents, sometimes to our children, sometimes to folks that have disabilities. It's a large workforce in Maine. There's over 20,000 people in it. They're folks who are highly trained in very, very responsible positions, and who regrettably are paid usually well below a living wage. And a living wage in Maine is between $10 and $12 an hour. So that means folks are getting $8-9 an hour usually to start to be a direct care worker.
And what are the settings that they customarily work in?
Direct care workers work in home care. They work in institutional settings, nursing homes, boarding homes. They work in group homes with developmentally disabled adults. They work pretty much in those different types of settings, and they have different types of job titles. CNAs often is one of them, home health aide, personal care attendant, and many, many other job titles. It's a workforce that's often hidden because they work 24 hours a day. So there's folks that might be working a graveyard shift who come alive at 5 or 6 in the afternoon when the majority of the workforce is pretty much getting done with work for the day.
So in the nursing home settings, I would expect that many direct care workers do have employer-provided health insurance, but fewer when you go to boarding homes and really few when you go to home health care. Is that an accurate picture?
That's correct, Kit. The direct care workers as a group sadly have a higher level of not being insured or uninsured level than the general population. And within the sector of direct care, within the group of direct care workers, the sector, the institutional setting, the nursing home setting, have a higher percentage, though nothing tremendous, but a higher percentage. And the home care center sector, which is the sector that most people are interested in and want the most, have the highest percentage of people that are not insured.
Well, Mila, you presided over this work group that met last summer. What were the findings of the work group? What did you find to be the challenges of meeting the healthcare needs of this group of healthcare workers?
I was really pleased with the work of the group. Initially, being new in town, I wasn't sure whether me picking up the phone and calling the insurance industry, the employer community, the direct care workers themselves, folks who represent the industry, would show up to help us think through all the challenges, to help us evaluate what the options may be. I was very thrilled to see the level of interest in the work, and I think the report reflects the creativity and the commitment of everyone who served on the working group, including Roy and some of his colleagues. So I very much appreciate that commitment and the voluntary service of everyone. We had direct care workers participating as well. Of course, they were not getting paid. It was on their own time. And it was quite helpful to hear from their perspective the struggles and the challenges that they face. What I learned surprised me. I think we have a perfect storm coming. We have a growing need for direct care service workers. We have a shortage in the workforce, and our population is aging and continues to age. So
the need's going to grow.
The needs are going to grow, and the shortage in the workers is significant. It's very hard to recruit into this profession. It's physically and mentally challenging to perform direct care services. The benefits compared to other industries are not very good, as you heard Roy's description of how health insurance is such a challenge. And so very few people want to go into this profession, and when they do, they like to get out as soon as possible to get jobs that provide health insurance benefits. The other piece I learned in all of this is health insurance is the key to retaining and recruiting direct care workers. In the course of doing this research, we looked at all the private health insurance options that exist, and we concluded that the private market is just not, doesn't provide the kind of options that direct care workers need. Coverage tends to be expensive, and direct care workers are mostly low and moderate income workers, and they just cannot afford it.
So that's the challenge for the individual worker trying to buy individual coverage, that's too expensive for them. What about the challenge for the employers who are providing this care? Why can't they provide employer-sponsored coverage?
Many employers do. The problem is the worker cannot afford even their share of the premium. Yeah. Their income level is just not high enough. So health insurance is a luxury.
I do want to make a couple points in response to what both the superintendent and the senator said. One is the jobs that direct care workers provide. They're not just good jobs in terms of the quality of work and the feeling people have fulfilling them, but they're good jobs because they're absolutely needed, and because they cut across the entire state. They're not located in one city, one county, one place. They're distributed throughout the state along with the population as a whole, and they're growing. They can't be exported. A direct care worker job cannot be sent over to Pakistan. I mean, it has to be done by a Mainer. And I think that's a real important point. I think another point that is very important to make is that there is a kind of a moral call for the government to look at its policies and be consistent with what the population wants and what people need. And the fact is that the government has laws that preclude the private sector from hiring people, without paying benefits and without paying, basically paying people under the table. However, the government has chosen to essentially export these jobs for direct care workers to the private sector so that the government itself does not have to be responsible for the pay and benefits. And it's kind of an odd conflict in my mind. And there's an issue around the different sectors in the fields where the policies that have been set up to pay for the services for the institutional side of direct care allow for a much higher level of reimbursement than for the home care side, which is really what people want.